Okay.
Come in.
Hi.
Hi.
How are you today?
Good.
My name is Christopher. I'm going to be your nurse today.
Hi.
Hi. Can I check your wristband really quick?
Yes.
And can you tell me your name and date of birth?
Vanessa Eldridge, 21787.
Wonderful, Vanessa. Okay, well, today I'm here to give you a physical assessment.
Okay.
Head to toe, we're going to go through everything. It should only take about 10 to 15 minutes, nice and easy. It's going to sound a little strange, but I'm going to ask you your name again.
Vanessa Eldridge.
Vanessa, and when are you born?
21787.
Awesome. And can you tell me maybe what, where we are today?
At the doctor's office.
The doctor's office. And can you give me kind of an approximate time of the day or what time it is now?
12:30.
12:30? That sounds about right to me. Okay, wonderful. Well, first question, are you experiencing any pain at all?
No.
No pain at all?
No.
So on a pain level of 0 to 10, you would say?
0.
0 being no pain at all.
Pain.
That's great. Okay, wonderful. Well, I am going to ask you, I'm not going to ask you, I'm going to just take a look and notice that you look your age.
Yes.
I'm looking at your facial features and everything is nice and symmetrical. Your eyes are lining up with the tops of your ears. Your eyebrows look great. Your hair is evenly distributed. I'm taking a look at your general physical appearance. You are sitting up nice and straight. Your head is erect and still. You're not using any accessory muscles to stay up. I am just going to take a look at your ears if you don't mind. First of all, are you experiencing any pain in your ears?
No, no pain.
Okay, I'm just going to go ahead and just kind of touch the top of your ear. Do you feel any pain there?
No.
Down by your earlobe
No.
there? And no pain when I push here?
No.
Okay, wonderful. No pain when I tap on your mastoid muscle here,
No.
huh? Okay, that's good. I'm not noticing any drainage or leakage. I'm noticing some ear piercings that are there, but they look nice and clean, so that's good. I'm also just going to check the patency of your nostrils. So what I'm going to ask you to do, if you wouldn't mind, is just close one nostril and breathe in. Great, and can you do that with the other nose as well? Perfect, looks really good. I'm going to get out my pen light here, and I'm just going to ask you to say, and I'm going to take a look down into your mouth if that's all right.
Yes.
Okay? Beautiful, so I'm noticing that your uvula is rising, everything is midline. Now, let me just take one more look just to look at your teeth. Your teeth look great. I'm not seeing any dental caries. They're your original teeth, and your mucosa is nice and pink and moist.
Yes.
So that's very good. Okay, Vanessa, we're going to kind of continue on here. I'm just going to check the check for bruits in your carotid arteries. So what I'm going to do is I'm going to put my stethoscope on. I'm going to take the bell of my stethoscope and I'm just going to put it over and auscultate your carotid artery. What I'm going to ask you to do though is, if you wouldn't mind, holding your breath when I do this. Okay? So you're just going to take a deep breath in for me and hold it. Very good, and you can relax. And then I'm going to do it on the other side, so you'll take a deep breath in and hold it for me. And there are no bruits noted, so that's very good. All right, wonderful. Now I'm going to go ahead and I'm going to listen to your lung sounds in the front and the back side and just make sure they're nice and clear, if that's okay. All right, wonderful. Okay, so just take a deep breath in and out. Very good. Deep breath in and out. In, out, in, out. Very nice. I'm going to just go over here. Deep breath in, out. Very nice. Thank you. In and out. Good. I don't want you to hyperventilate, so I'll give you a second to recover there. I'm going to just take a listen to the back side, okay, now? And same procedure. I'm just going to move my stethoscope around. Inhale and exhale as we move, okay? So take a deep breath in. Very good. Deep breath in. Good. In and out. Good. In, out. Good. Very good. Well, your lungs sound great. No adventitious lung sounds. I'm going to go ahead and just listen to your heart right now, and we'll move from there, okay?
Okay.
All right. You can just relax, all right?
Okay.
Okay, and if you wouldn't mind lifting your breast tissue so I can go ahead and listen right under here. Okay, wonderful. I'm going to go ahead and take your apical pulse rate, so I'm going to listen for just 1 minute, okay? Okay, it sounds really good. Apical rate of 80.
Nice.
Yeah.
That was a long minute.
It was a long minute. It takes a minute, a whole minute. Okay, wonderful. I'm just gonna go ahead, if you don't mind, I'm gonna touch you. I'm just gonna make sure your skin is feeling nice and warm and dry. I'm gonna take a look at your hands here. I'm just gonna check for your capillary refill, just a little squeeze. And it looks like it's less than 3 seconds, so that's very good. Okay, I'm gonna take a look now at your nail beds here. Make sure that there's a nice little indentation there at 15 degrees, 45 degrees. So there's no clubbing noted, so that's very good. Now I'm going to just check your arm strength.
Okay.
Check the strength in your arms. So yeah, you can just go ahead and make fists like this. All right, so I'm just gonna push on the outside and you push out. Very good. And pull in. Very good. And pull towards you. Good. And push towards me. Very nice. So we've got +4 in the upper extremities. That's great. Now we're going to check your lower extremities. I'm going to do the same thing. You're just going to go ahead and put force forward and you just push towards me. Very good. And pull in. Good. And push out. Very nice. And pull in.
Oh.
There you go. That's
I
good.
went the wrong way.
+4. Very nice. Okay, wonderful. All right, now I'm just going to ask you to lay down. I'm going to pull out this little the bench thing here. Have you lay down. I'm just going to listen to your bowel sounds, okay? And so, first I'm going to take a look and I'm going to inspect the contour here. And basically what I'm seeing is a nice flat contour. I'm seeing that it's very symmetrical. I'm not seeing any abnormalities in shape or size. Can I ask you how your diet is?
It's okay.
It's okay? So what would you say? Would you say you have a nice, healthy, high fiber diet?
Yes.
Okay,
Yes.
that's great. That's wonderful. And have you had any pain in your stomach at all?
No.
Okay, so what I'm going to do is I'm just going to be listening to the 4 quadrants in your tummy and just listen for some bowel sounds. And if you're experiencing any uncomfortableness or any pain, you just let me know right away and we'll stop, okay? All right, wonderful. Would you just mind showing me where your umbilicus is? Awesome. Kind of give me a point of reference here. Beautiful, thank you. Okay, you can go ahead, just relax. Wonderful. Your bowel sounds are present and active in all 4 quadrants, so you are good to go with that. And now I'm just going to go ahead, I'm just going to kind of feel around on your tummy and I'm just going to feel for any masses or lumps or pain or discomfort. You just let me know if there is any discomfort. Just let me know, I'll stop, okay? Okay. You feel any pain?
No.
Okay, I'm seeing that she is not grimacing. There is no pain in her face. I'm not feeling any masses or any distension of any type. So you're good to go. Okay.
Yeah.
Now you can you can go ahead and sit up. I'll pull this in for you. What I'm going to do is I'm going to feel for your pedal pulse. Okay. Yeah, that would be absolutely great. Okay, wonderful. Thank you. All right, so I'm just gonna feel. Yeah. Beautiful nails, by the way.
Thanks.
Okay, so we've got a +2 pedal pulse. That's very good. And that would be bilaterally. As you get your sock back on there, that's great. And the shoe, we're making waves here. I am going to, we kind of did this a little backwards. I'm going to ask you to lay back down. I'll pull this out so I can just check for DVTs in your leg. I don't have to?
No.
I think we do.
Oh.
We're going to check just in case. I need a good grade. Just kidding. So here we are checking for DVTs. Do you have any pain in the backs of your legs here?
No.
Okay. Do you have any, so no pain. Okay. Well, I'm not noticing any swelling. I see no redness and there is no warmth. So there is no DVTs. So that is good.
Yes.
Okay. Now I'm going to ask you a simple task. I'm just going to have you pop on off of there, and I'm just going to ask you if you wouldn't mind just taking a few steps casually from here, maybe to that whiteboard, turn around and come back. Very good. You have a nice steady gait.
Thank you.
Very steady gait. Okay. Now, just to go back to cover a few things, do you wear hearing aids, Vanessa?
No.
You don't wear hearing aids, and you've never had trouble hearing?
No.
Okay, great. Now we're going to go, and I'm just going to take a look into your eyes.
Okay.
So I'm noticing that you do wear glasses. That you wear glasses normally.
Yes.
Okay, great. Well, when I check them, I'm gonna ask you to take them off, but before you take them off, could you just do me a favor and read this right here, what's on my name tag?
Chamberlain College of Nursing.
That is very good. Okay, so I'm gonna just shine a light into your eyes. You can take your glasses off for me if you would. I'm just gonna be checking your eyes here, so you can go ahead and just look at me. Very good. Very nice. Okay, now I just want you to just go ahead and look at the tip of my pen right here, and I'm just gonna bring it in towards your face, okay?
Okay.
Very good. So Perla and accommodation, it's all there. Looking great. Wonderful. I am just going to check your carotids, and I'm going to be checking your the force of them. So I am going to do one at a time so that you don't pass out, okay?
Okay.
All right, wonderful. All right. Nice and strong. +2 and +2. Okay, I'm just going to take your radial pulses here. You can just relax. And they are +2. Nice and strong bilaterally. Okay, wonderful. Well, I'm just going to take a set of vital signs for you and get all of that information. So I'm going to take your temperature, I'm going to take your pulse, I'm going to check your respirations, your blood pressure, and your O2 stats, SpO2,
Okay.
see how much oxygen is in that blood.
Okay.
Okay. Your vital signs are within a very healthy and normal range. So that is done with. Well, Vanessa, thank you for coming in for your head-to-toe physical assessment. You did great.
Thanks.
And we'll welcome you back anytime, but you are very healthy.
Thank you so much.
Thank you. Bye.